If you've been told that your spine is too far gone, I'm here to tell you that it's not. Yeah, so the mindset of the active individual or the athlete is very different than, the traditional patient that we see. Most traditional patients, they're trying to solve for pain. They're really uncomfortable. Maybe they can't do certain things that they could do previously as a result of having the pain. Professional athletes, active individuals, even semi-pro athletes, when we work with them, it's kind of different. They're used to working through pain. They're used to having pain because they do things repetitively for many, many years, and they push their bodies to a different level. And what they're really looking for, the mindset shift, is that they want to continue to function. That's their primary objective. It's not so much about just short-term pain relief or even long-term pain relief for that matter. It's more about returning to doing the things that they need to do in order to be the best version of themselves within that sport or within that activity that they love and enjoy. So they're really looking at the long-term functional benefits without all the downtime and without all the future issues that might come with surgery. So cutting a disc out, like in a microdiscectomy situation, it solves for leg pain. However, it destabilizes the motion segment and it accelerates the degenerative process down the road. And many people understand that because the literature is very clear there. So what athletes really care about is longevity in that activity, whatever the activity is, whether it's pickleball or football or baseball, it doesn't really matter. They want longevity in that activity because they love to do that and it's their passion, it's what they're here for. So, they're looking for procedures that don't necessarily produce the same long-term downside, if you will, right? Because what I always say is with surgical intervention on a spine, it provides us with short-term relief, but there's a tax associated with it long-term, regardless of the surgery. If it's a fusion, we get accelerated degenerative changes much faster. If it's a microdiscectomy, laminotomy, they happen a little bit slower, but they do happen. And the thing is about those particular surgeries is they're not necessarily designed to solve for back pain. They're typically designed to solve for the leg pain or the extremity pain that may be consistent with the fact that there's irritation to a nerve root. So it's a completely different paradigm, especially when you're dealing with active individuals. Please be sure to check out our other videos, and if you have any questions, please leave them below.